We're getting lots of background noise, so I don't know where that's coming from. Okay, Mr. Chairman, we're ready to go.
All right, thank you. We'll go ahead and call this meeting to order of the Eastern Idaho Board of Public Health. We welcome the public who is able to view the meeting with us. We've tried to make these meetings as accessible as possible for the public. They can be seen on our YouTube channel, which has been set up. There's also a room available at the building of Eastern Idaho Public Health for any public who may come to the meeting location for the meeting. So this has taken a considerable amount of effort, and of course we appreciate our staff at Eastern Idaho Public Health and the long hours that they are putting in and have put in for months now. So we appreciate the service that they give our community. Also welcome some guests that are in the meeting with us, Dr. Landers and Shannon Fox, as well as hospital administrators that we'll all hear from a little bit later. So we do appreciate the help and service that you two are providing. We'll begin with a roll call of our board members. We'll start with our physician.
Dr. Barbara Nelson here.
Thank you. And Custer County. Commissioner Butts.
Commissioner Butts present.
Thank you. And Lemhi County.
Commissioner Minor present.
Clark County.
Commissioner Shenton present.
Fremont County.
Lee Miller present.
And Madison County.
Commissioner Mendenhall here.
Jefferson County.
Jane Young present.
Teton County.
Bill Lake present.
And I am Brian Reed representing Bonneville County. Did I miss any board members? Okay, thank you. We have a full contingent from our board, and which has mostly been the case. And again, significant time has been put in by the board, and I appreciate each and every one of you. We'll begin with an approval of our October 8th Board of Health minutes. You can see them on the screen. They've also been sent out to us in advance. Can I get a motion to approve those minutes?
I move we approve the minutes.
I'll second that.
Thank you, Dr. Nelson. And the second was by Commissioner Butts, is that correct?
Mendenhall.
Nope.
Oh,
Commissioner Mendenhall.
Commissioner Mendenhall, I'm sorry. Thank you. So we have a motion and a second. All in favor, say aye.
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 Is there anyone opposed? All right, thank you. We will go right on to the next item on our agenda, which is a report from our hospitals regarding ICU and overall capacity. Again, we appreciate the help that you have given us. It's been important for us to keep up on these numbers weekly, and we even get reports through the week. I know our director contacted me on Sunday and said that she had received some reports Saturday and Sunday, and so we do appreciate you keeping us on what's happening. We'll start with Idaho Falls Community Hospital. Mr. Jackman, are you on the line?
I am. Good morning.
Good morning.
To report for this week, we are currently seeing a downward trend, which is good. I have 10 patients total, 3 of which are in the ICU. All 3 of those are on ventilators. This weekend, we did have a couple of tense hours as we had gotten up to 10 in the ICU with 7 on ventilators. Now I have 8 regular ventilators. We could have intubated one more, but that would have left us without any intubators, and that puts us in a precarious spot. Currently, I'm using 6 ventilators. I have 3 for COVID and 3 for non-COVID. So we're sitting in a good spot now. We have made arrangements to purchase a couple more, but due to the manufacturing demands, it's going to be mid-December before we will have those.
Okay, thank you. Are there any questions for Mr. Jackman? All right, we'll move on to Eastern Idaho Regional Medical Center then, Mr. Gothenberg.
Good morning. Can you hear me?
Good morning, we can, thank you.
Good morning, Commissioner Reed. We are seeing a pretty high census still. We're sitting at 37 patients with COVID, 6 in our ICU, and of those, 4 are ventilated. And wanted to just highlight kind of the dynamics that we're seeing in terms of where our patients are coming from. Though we're sitting at 37, right now, a large number of those, a total of 18, are from outside of Bonneville County. And just to give you an idea of the range where patients are coming from, we have patients currently from Power County, Lemhi County, Franklin County, Lincoln County, Wyoming, Jefferson, Madison, Bingham, Teton Valley, and obviously, and then Fremont as well. And then obviously one from here. And then we have actually one resident from California who is in town visiting. So we're seeing patients from all over the region right now. And I think where we have been focusing our efforts, obviously improving our staffing, which is in a much better position than when we have been, and we continue to get employees hired. Just to give you an idea of the amount of hiring we've done over the last 3 months, we have hired upwards of 150 employees, and 60% of those being nurses. Not all of them are ICU or PCU nurses, but nurses that are certainly helping our needs across the facility. And so as we get those nurses off orientation and into their roles, that's obviously helping us. And as we go into the winter time, we have plans to bring in additional travelers to help us in the anticipation that we continue to see a large percentage of our patients being COVID. If you look at our 37, that's a very large percentage of our overall census, that if COVID was not here, we would be seeing significantly less patients in our facility, and we would look like we did this time last year, which this tends to be one of our lower census times of the year, but we still sit at our total capacity in the hospital very, very high. And so we are managing very much better than we had been in prior weeks, even with the increased number of COVIDs. Staffing has improved. Our ICU census is actually as good as it's been, and the majority of these patients have like I mentioned, 37 and 6 in the ICU, the vast majority are in the med-surg side, which does create some challenges with our throughput, and those beds, with the length of stay these patients have being a little bit longer than our normal med-surg patients, they sit in these med-surg beds a little longer. So that's been a challenge. And we've been working with some of the hospitals throughout the region that when a patient's appropriate and can finish their acute stay in their home community, we're looking for opportunities to get those patients back. So we appreciate the partnership from our hospitals throughout the region to get those patients cared for closer to home when appropriate. And so we continue to work through that with them. And as of right now, we feel as though the numbers are high, and we continue to manage through the situation.
Right, thank you. And we appreciate the work that all the hospitals are doing, but to buy extra equipment, to go out and seek those ventilators, to hire more staff, we appreciate all that you are doing to help manage this situation. So thank you, and we appreciate that report. Any questions for Mr. Hoffenberg? We'll go ahead and move next then to Madison Memorial Hospital. Dr. Gonzalez, good morning.
Good morning. How is everybody?
Fine, thanks.
Good. I got a smile still, right? So we're doing pretty decent at Madison as far as admitted for the primary diagnosis of COVID. There are 3, and I appreciate Casey and David helping because I've been asking them how many patients from around the region are going to their facilities as well. And Casey also has patients from Madison County and others. And we certainly know this as hospitals because we transfer patients to, other hospitals based on specialists and what that particular patient needs. One thing that I thought would be helpful for the board to know is, if you think about the complexity of, if you're just talking about COVID or even other transplants, some of these patients have to go to Utah. So if you were a transplant patient, for example, and that transplant occurred at either IMC or the University of Utah, you tend to go back to the facility where you had that primary procedure. And if you're admitting or your secondary diagnosis is COVID positive, some of those things are becoming a little more complicated. And so I just, if there's questions, certainly any of the administrators, we can answer on that. But my point is, I try to get it. I don't know, and I don't know if you know, Jerry, but I don't know how many from our region are admitted at this moment at IMC or the University of Utah. I also know that the other, I think it was, I don't remember if it was last week, even before, I brought up the complex of the different diagnoses. So if you're, for example, I brought up a COVID positive delivering mother. It's a little different than if you are delivering and you're not COVID positive. The other thing that I'd like the board to think about, and is perfect for today's topic, is the patients that I know we're all seeing, and we've had a mental health crisis across this nation pre this pandemic. And unfortunately, we're not set up in the facilities to care for COVID positive acute care mental health patients. The trying to, those normal patterns are getting even harder for that particular type of a patient. And certainly everyone in the region is doing everything that they can. It's just the capacity. And so again, that may not be these numbers that we're always reporting as far as the primary diagnosis, but these are other types of patients that certainly need the hospitals that have that, diagnosis of COVID positive, that we're trying to meet the needs of their acute mental condition or physical condition, whether that's delivering or, like post-transplant care. So just kind of an FYI of the big picture I was trying to help with. I guess one other thing is I think all of our hospitals I think we all average some staff, like all the businesses, that are out sick. And so it's no different for the hospitals than a lot of the businesses have to deal with on that. I think that's it, unless you have any questions.
Thank you so much. Are there any questions for Dr. Gonzalez? Jerry, did you have anything else you wanted to add?
Yes, Mr. Chairman, I just wanted to share also that have been in communication with Still Memorial Hospital, and they are certainly seeing an increase in patients that they have there at their hospital, which has certainly increased in recent days. So just to be aware of that.
Okay, great, thank you. All right, again, we appreciate all the work that the hospitals are doing. I know they're all working so hard, and please pass on to your staff, your doctors and nurses, how much Eastern Idaho Public Health and certainly the entire community appreciate all the work that is being done. So we value them very much. We'll go ahead and move on to the next item on our agenda, which is a presentation on mental health impacts of COVID-19. We have Dr. John Landers with us, who is a clinical psychologist. He's been practicing in Idaho Falls for over 10 years, and from my understanding was previously in Washington, Oregon. I know he's been around the world working on mental health issues, and we appreciate the time that he has taken to prepare this presentation for us. So thank you. Good morning, Dr. Landers.
Good morning, Chairman Reed. Thank you. So Director Reed, or Chairman Reed, Director Racco, board members and guests, thank you for the opportunity to present. My plan this morning is to use some data to answer some questions that were asked of me by the board. And so it looks like my presentation is up there on the slide. So I'm going to just kind of go through and hit some highlights. I'm not going to read through everything. There's a great deal of information. I certainly encourage folks to digest it for themselves. I'm going to start just by going down to slide number 4. So the first question that was asked was, what's the effect of mental health based on the pandemic? So I've got 3 citations here towards the end of my presentation. There's a citation index. So if you want to go back to that exact research and not use my digestion of it, you're welcome to. But 3 main effects that I'd like to highlight. First of all, is that in comparison to pre-pandemic data, our anxiety disorders are at 3 times what they used to be. Our depressive disorders are at 4 times what they used to be. And suicidal ideation is at least double, if not just a little bit more. So pretty significant canaries in the mine, if you will. Those are the ones that we look for and say, wow, if those things are increasing, there's probably a great deal of suffering in the community. And these are direct effects of the pandemic, not necessarily stress because of fear that one might catch COVID, but the totality of the effects of the pandemic. Then as we go down further, the second question that was asked is who is most impacted? So I'm going to go to a particular study that was done by the CDC this summer. It was published in August. And what it does is it looks across a variety of different mental health conditions and then stratifies those results by different groups. So gender, race, ethnicity, income, employment, etc. And so really the number I'm going to look at the most is in the far right column.
Then I'll shut the damn thing off. I am so sorry.
In the far right column where it says all respondents, and then we go all the way over when it says basically 1 or more conditions, that number is 40.9. And that number is significant because if you look at the epidemiological data on rates of suicide at any given time in the United States, in the past, it's about 25%. So we take a slice of the population in the United States at any given time, we should see about 25% of the population experiencing a mental illness. Right now, we're seeing about 41%. But then as we go down, we can look at, okay, where is the most vulnerable? So female versus male, there's not really a significant difference. If we look at the next slide, slide 7, there is a significant difference for age. Now, this was only done with adults. We can assume that the trend would continue to go into adolescence in the same way, but that's an assumption. So at least looking at this data, we can see that as one ages, one is less likely to have a mental health condition as a result of the effects of COVID. So it's the exact opposite of what we're seeing as far as vulnerability to COVID, as far as vulnerability to mental illness as a result of COVID. So the number there that's most stark is this 18 to 24 age group, which is 75% essentially. And if you look at suicide rates, that particular group, suicide is the second leading cause of death in Idaho, aside from accident. So we're going to see significant effects in our younger population, quite tragic, and I'm concerned about that. When we go to the next slide, slide 8, as far as race and ethnicity, this is a difficult slide to interpret. You can see in that last column that minorities tend to be above the mean, aside from Asians, whereas Caucasians and Asians tend to be below the mean. The highest number there is Hispanics. My interpretation of the data would be to say it is because of correlations within these groups with other risk factors. It is not the nature of being Hispanic, if you will, that makes you at risk. It's the nature of other factors that are correlated to being Hispanic. So I don't want to put a lot of hay into this, but certainly our minorities are more at risk than the other parts of the population. So when we look at income on slide number 9, there is an effect. It's not enormous, but certainly as a household has less income, they're more vulnerable. And the unfortunate part about that is as you have less income as a household, you typically have less resources to access mental health treatment, as well as just having the support or resiliency factors in place naturally to deal with those effects. Slide number 10 is on education. Again, here we have a stark effect. Now these are adults. So we're looking at adults with less than a high school diploma, all the way down to adults with a professional degree. So really what we're looking at is the less education you have, then the less resources you have, the more effects you're going to have from the mental health impact of the pandemic. So that's something to pay attention to. That's our vulnerable population. The next slide is employment status. This is an interesting slide. There's a couple of things I'm going to highlight here. The retired individuals, you can see that they're 19.6%. So if someone is retired, they seem to be somewhat insulated from the mental health effects of the pandemic. The most at risk is the essential worker. And that might seem odd to folks. It's like, well, why would someone who's guaranteed employment, who's not going to be somehow reduced and forced because of the pandemic, why would they be affected? And I certainly think we could hypothesize about that. One area that I'm going to focus on a little bit later would be the healthcare worker, because they are essential workers. So we'll save that discussion until that slide, but certainly an interesting one. So slide 12 is interesting because of the non-effects. One might hypothesize that the stress of being infected, the stress of death associated with COVID is going to lead to increased mental health effects. And you can see there in that column that those that have experienced the illness themselves or have had someone who has died from the illness are no more likely than someone who has not had that to experience mental health effects. So the stress of the illness is what I would get from this slide is not seeming to affect the mental health status of individuals. It's not the actual COVID that's causing it. It's the results of it that are pretty profound. So the next slide, slide 13. Here we have those canaries in the mine, if you will. So anxiety, depression, and post-traumatic stress disorder. And so on the far left side, what we have here is yes, no. So of all the respondents, yes, you were receiving treatment prior to the pandemic versus no. And was the treatment for anxiety, depression, post-traumatic disorder, post-traumatic stress disorder. On the far right side, we can see the yes versus no. I'm going to focus on the no's real quick. So what's interesting for me about the no's is, so no on anxiety, I wasn't receiving treatment prior to the pandemic, or depression or PTSD. That group is about at the mean for everyone, meaning that folks that did not have a mental health condition and or weren't being treated for that condition are now having that condition at almost 40% rates. What's more profound though is when you look at the yes. So if I had a pre-existing condition, how many folks are now experiencing heightened distress? And that number is astronomical, especially for those who had PTSD. This is significant. So certainly the vulnerable population are those that have had mental health conditions prior to, but just because you haven't, it does not insulate you from developing a new condition. That's the take home from this data. So next slide, 14 is question on healthcare workers. So here's the data on slide 15 regarding that question. So essentially it falls into two areas. You can see the citations here if you want to go further. And these are all fairly recent studies because we're dealing with the pandemic. So this is all data that's generated within the past several months. So the two issues that we're dealing with here are actual mental health symptoms or burnout. And burnout really is defined as the distress that one feels in a situation where one's out of control and does not feel that you have the resources to deal with the stress. So it's the beginnings of a mental health condition. It's not necessarily a diagnosis in and of itself, but it certainly is the beginning stages of such. So when we look at healthcare workers, that's what HCW stands for there. Just a few highlights from this slide. So number one, we have increased utilization. We've heard from our hospital administrators on that, and that's certainly the case that our numbers of utilizing the hospital beds is up. Certainly a lot of that's because of COVID. We also have a shortage of healthcare workers that has been there prior to the pandemic, but it has been exacerbated by the pandemic. Because if you think of, we have higher utilization, but we have a shortage, now we have a supply-demand issue. And I spoke with hospital leadership where I'm associated within the past week in preparation for this presentation. And one thing that was told to me from the hospital leadership standpoint is this little second bullet under the second bullet, which is talking about turnover and hard to fill positions. That seems to be the biggest impact, is that in either non-clinical or entry-level healthcare professionals like a surgery tech, you're seeing high levels of turnover and difficulty filling those positions once they're vacated. The thought being that I can earn the same amount of money working at another place and not expose myself to the virus and not expose myself to the stresses of working in this type of environment. So that makes the shortage even more difficult, which then places a great deal of stress on those who are still left. And you can see my second to last slide there is nurses. Nurses are the glue of hospitals. Hospitals cannot operate without 24/7 staff. And who are those 24/7 staff? Those are nurses. And if someone is not doing something because they're not there, guess who gets that job? It's the nurse. And if someone needs to work an extra shift, that's going to be the nurse. These are real people. They have real families. They have the same concerns that we do, that they're dealing with outside of work. But work is dominating their time in a way that is more than perhaps other folks. So nurses are sort of the individuals that are getting the biggest hit here in healthcare. And then the final point here is really a concern, I would say, points back to healthcare workers themselves and their style. We tend not to do well about seeking help for ourselves. We tend not to spend our leisure time doing adaptive coping. And so it would be important for healthcare workers to take a little bit of time to consider their own state and spend a little bit more time caring for themselves, setting boundaries, appropriately communicating their needs, etc. All right, so slide number 16, a question on how has the pandemic impacted what's seen in the clinical setting, and what is meant by that is in, say, something like my clinic where I'm seeing mental health directly. And certainly there's been an increased demand. There's data to prove this, that mental health services are in much higher demand now than they were pre-pandemic, and both triggering new mental health conditions that have not been in place before and exacerbating existing ones. And we saw that on the slide earlier when we were talking about anxiety, depression, and PTSD. So going down to slide 18, about the decreasing supply, right? So you have increasing demand, but now we have decreasing supply. And what's happening here is across the world, we're having disruptions in services. And I know of clinics that have closed down because of staff members or infections that have been in their clinic, and so they have to close down services. But it's not just that. It may be that there's childcare issues, and these individuals are now dealing with education at home or childcare issues at home. So there's such a wide array of reasons for it, but nonetheless, mental health services are not in high supply. as compared to prior to the pandemic. And there's some numbers there you can look at as far as what specifically is being affected and how so. But one thing that I'd like to point out locally that we're seeing is that there is a decrease in private payer and increase in Medicaid utilization. I don't know what to necessarily make of that. I certainly think we could guess, but at least what we know is that the folks that are out there in the population and have benefits are not getting those services that perhaps they need. Those that maybe are not working and are vulnerable are certainly using their benefits to get more care, and that's good. But that's the difference that we see in the clinic. Okay, so question 5 is the impact due to the fear of the virus versus the stress from the reaction or the necessary reaction. So the data on this is yes. Anytime you ask an either or question, the typical answer should be yes. So yes, both are affecting. The first bullet there is the idea that the fear of the unknown always leads to stress. And so certainly there is going to be stress related to the pandemic itself. And we can see that in that 40.9 statistic. So you've got 41% of the population versus 25% of the population is experiencing mental health effects. So certainly the pandemic is leading to the fear of the virus is probably leading to some mental health effects. However, if you look at slide 12, I'm not going to go back there, but if you go back to slide 12, you can see that the effects of the virus really aren't showing an increase, yes versus no, as far as increase versus decrease in mental health effects. So really what seems to be the primary driver of this increase that we're seeing is the restrictions. So lack of access to employment or changes in your employment as far as demands. I'm sure the folks in public health can talk about, if they were asked, the increased demands for their services and how that's affected their personal stress levels. Education. There's certainly been an impact in education for teachers, for administrators, for students. Support. People that normally would be interacting with other supports are not interacting with those supports. And then access to activities like leisure, essential goods and services, mental health services, medical services. These have all been impacted. So the answer is yes, we are certainly being impacted by the fear of the virus, but more we are being impacted by the restrictions and reactions. I'm not saying they're unnecessary, but I'm saying that the natural reaction to the pandemic has certainly led to a great deal of the mental health increase in symptoms. So question 6, what can we do? That's a great question. What can we do? So I've broken this down into really 3 groups. So Eastern Idaho Public Health, private businesses, and just individuals themselves. Eastern Idaho Public Health, the main message that I have for you is my quote right there, smack in the middle from Dale Carnegie, is that the only way on earth to influence other people is to talk about what they want and show them how to get it. If we're going to influence people to do the mitigation strategies, which I agree with, we have to connect those mitigation strategies to what people want. They have to understand that if I want my child in sports, if I want my child in school, if I want to be able to go to work, any of those things that we want, we need to all together work to use those mitigation strategies to keep the levels low enough so that our hospitals are not overburdened, so that we can flatten this curve. So that's my main consideration for Eastern Idaho Public Health. The rest of my bullets are really oriented towards that idea. You cannot do it by yourself. If we engage our community leaders, our businesses, and other folks in assisting us, and we all work together, then yes, we can. But we have to use persuasion and connect people to what they want with those mitigation strategies. So considerations for businesses, if I were a business owner, I would want to make compliance my rule of thumb. And I can go into businesses here in town. I'm not going to name them on the presentation, but I can go into businesses here in town and I can guarantee their employees are all wearing masks. And I can guarantee they're using other mitigation strategies. I can go into other businesses, and before I even go in, I can guarantee that they're not using these strategies. So if I'm a business owner, I would want to make compliance my rule. And then I would secondly want to support my employees and even customers in using these strategies. I also want to make my workplace a healthy place and make sure I'm trying to balance work-life issues. And finally, I'm going to want to encourage my employees to seek help and resources when they're struggling. So those are all basic things that individual business owners can do. That's way beyond the scope of Eastern Idaho Public Health, but it is not beyond the scope of individual business owners to do. Individually, so slide number 24, what I would ask individuals to do is, first of all, consider the idea of personal responsibility. We talk about rights, but rights cannot be separated from responsibilities. When we talk about mental health and the people that are more resilient versus those that are more vulnerable, one particular variable always seems to stand out. And that variable is, does this person have an internal versus external sense of control? If the person has an internal sense of, I have personal responsibility, I have the ability to respond, if you will, that creates mental health, that creates resiliency. If the person has an external sense of control, meaning there are outside factors and I am a victim of those outside factors, that creates a vulnerability to mental health symptoms. So take personal responsibility, be a part of the solution, engage in compliance strategies, and encourage other people to do that. I can't emphasize that anymore. Second bullet, if you're someone who's experiencing symptoms, seek support. Support is there. You'll see in my next slide where I'm giving you some sources of support, and I'll highlight those in just a moment. And then finally, provide support. Look around you. There are people in your circle, if you will, that are probably suffering. Take some time to provide support. And as you do so, you'll find that you gain support from that process as well. So some just basic strategies individuals can use. So as far as community resources, slide 25, I've just given you some that are there. We pay taxes. Here's why one of the things that we pay taxes for is so that we all have available services when we are experiencing a need. And so here's some available services that you can access: the Care Line, Suicide Prevention Hotline, behavioral health through Department of Health and Welfare, and the Crisis Center here in Eastern Idaho. All wonderful resources staffed by professionals who can provide assistance and point you directions that maybe you weren't aware of. And I think that is my presentation, so I'm certainly happy to answer any questions.
Thank you so much, Dr. Landers. That was well prepared. Obviously, you've put a lot of time in that. It was answered many of our questions, and we really do appreciate it. I guess I'd like to go back before I ask the board for questions. There was many things that was concerning, but certainly the 18 to 24-year-olds, why that was so high in that age group. And you mentioned that it may be the same in younger. So say the high school, junior high students, that it correlates with them as well. Why is that, I guess? And is it because of what's happening in the school system, or what can you do to help us with that? Because that's certainly very concerning to see that age group dealing with those issues.
Thank you, Chairman Reed. I'll do my best to try to simplify, because there's many variables I think we could point to. But as you are younger, there's several things that we can look at. First of all, lack of experience, lack of wisdom, lack of resiliency. Those of us who have a little bit more mileage on us have been through some things, and we recognize, hey, we can get through this. This isn't any different than prior things. Younger folks don't necessarily have that. Another thing younger folks don't have is they don't have control. Right? They're in the co-pilot chair. They're not in the pilot chair or the gunner seat. They don't have the ability to attack or do something directly to control their situation. They're being impacted by other people's choices. So I think those are probably the two things I would point to, is lack of resiliency and lack of control. And I can go back to just years and years of studies to show you that those are two factors that lead to greater mental health effects. So that would be my answer to that question, if that answers it for you.
Yes, it does. I guess then I would go follow it up with, what can we do to help them the most? Does it go back to what you were talking about, to just work together to provide the mitigation strategies to show that we're all together? It concerns me so much, the divisiveness that we see within the community, and that probably concerns the children, the younger group as well, because as you said, they don't have any control over that. Am I correct in that thinking? And what can we do to help?
Absolutely. Being divisive as adults is going to trickle down to our younger folks. So what we can do as adults on that particular front is join together in trying to create solutions that solve problems in a balanced way. Rather than staking out our territory and saying, this is my message and I'm going to stick with my message. If we can reach out and say, okay, I've got a concern. That's what I've done with public health. And we've had some, I think, great conversations. So if we can say, look, I've got a concern, and the other people can hear that concern and say, well, here's my concern. Really, the discussion now is about compromise. How can we meet everyone's needs as best we can? And that gets rid of the divisiveness. And then that helps us then to point to the second part of the question is, how do we help these folks that are being affected, that are vulnerable? So as far as I'm concerned, what you do for those that are vulnerable is you provide them resources, right? Because internally, they don't have those resources. So we need to externalize those resources, those supports. And that's where something like, for example, education is so important. This is a healthy system that is not just for education. School is not just for education. That brick and mortar building provides so much more than just a classroom. It provides these students with access to activities that give them a sense of purpose. It provides these students with connections to social supports that are peers. It connects them to healthy supports that are adults. So there's so many things that they need access to. And if we take away that access, we have eliminated the supports that make them able to withstand unhealthy situations. So we're hitting a high level of stress, and we remove those supports. We're creating a firestorm for these youngsters.
Thank you. Are there questions from board members for Dr. Landers?
Yeah, this is Dr. Nelson. I have a question for John. These mitigation strategies are here to stay. And what does it do to the resiliency of the kids who see oppositional, see all the stress in the communities? I mean, our goal is to try to keep the schools open, try not to shut down. And the best way to do that is to follow these mitigation strategies. But there's so many parents that are protesting, oppositional, trying to get judges to overthrow these mandates. What is that doing to the mental health of the children?
It goes, thank you, Barb. The problem here is the contention, the divisiveness, and that leads to confusion. It goes back to what Chairman Reed was mentioning with divisiveness. So as children are in these situations where there's this divisiveness, there's this lack of understanding, it for them creates a vacuum. And that vacuum is going to be filled with stress, depression, anxiety, other things like that. So the best thing we can do is all sides need to come together. We can't label groups, and I'm going to be, I guess, fairly direct, is we can't say these parents or those people or public health or administrators or teachers. What we have to say is, how can we understand this person's perspective? How can we come together and understand, why are these parents so upset? I sit in my office every single day and see the impact of the mitigation strategies. And I know doctors that are in the hospital see the impact of COVID, right? So both are correct. Neither one is invalid. And so if we can come together as adults and always assume that the other person we're talking to has, number one, a noble motive, and number two, work to understand what that noble motive is and come together and try to create a solution that is a good compromise, I think that's the solution. But the kiddos are going to be negatively affected by the divisiveness because it creates confusion.
Thank Thank you. Are there other questions?
Yeah, this is Bill Lake.
Go ahead.
I appreciate what you're saying there, Dr. Landers. But based on the number of emails and messages that we're receiving daily from folks that are just opposed to any advice public health is putting out there, it's basically, it could be a full-time job responding to those individuals. So I'm wondering if that's something that we should consider, is getting somebody to help us help them understand, and for us to understand where they're coming from, because as a board, we can't manage, we can't deal with all those people as a board. So what would your thoughts be? And Jerry, certainly weigh in on this, and other board members. Do we need to get somebody to help us with this?
Thank you, Bill. That is an excellent question. And if I can invoke just some history here, I'll give you some advice that Jethro gave to Moses. We absolutely need captains of hundreds and captains of 50s and captains of 10s. Eastern Idaho Public Health, the commissioners, our medical folks, they can't do this all by themselves. Absolutely not. I don't know that that means hiring more people, but certainly it means delegating. And so one example would be other community organizations that have an interest in this. Hospitals, schools, they have an interest. They can take on some of this weight, if you will. Business owners, they have an interest in this. If we have a shutdown, they're not going to be positively affected by this. They can have some ownership in this. And so I would direct, if I were giving advice, I would direct public health to spend their energy not on the million Israelites, if you will, but on the captains, the leaders in the community. And then those leaders then can deal with those people in their structure. Otherwise, you're right, you're going to be worn out and this isn't going to work.
Mr. Chairman, may I?
Go ahead, Dr. Buitrago.
Thank you, Dr. Landers, and thank you, everybody. I think that what you might want to do, my suggestion is create a task force. I think this is an example where being proactive is what works. We had a serious mental health issue to begin with. We have poor infrastructure, poor resources, and yes, we have an event and now we're in a worse position. So I think that a task force with individuals that have no conflicting interest is in the best interest of the community. Most cities that have success on mitigating problems have created specific task forces. And so that's what I would recommend, be it a COVID-19 task force or be it a mental health task force. If what we come out of this is that we're going to have a comprehensive mental health plan for the city, that'd be great. And if that extends to the schools, that's great. The schools have very little resources to help with mental health. They had one teacher mentioned there was 2 mental health counselors for a whole school. So create a comprehensive mental health plan for the community and the schools with a task force. I think that's ideal, and make sure that there's no conflict of interest with the members.
Thank you for that, Dr. Buitrago. That's an excellent idea and something that we need to review, because based on what we've learned from Dr. Landers, we need to bring people together. We need to bring opposing views together for our primary cause. And if I might interject, I think this is so much what we're trying to do, and particularly 2 weeks ago as we were advised to remove the other mitigation strategies from the orange, and we did that. And I know it caused some confusion with rising numbers and why we would remove, and it was not backing off. I think it was more of an attempt to do exactly what Dr. Landers now is advising and has advised us, is to engage the community more, to reach out to other community leaders, to all the elected officials, to get their help on it and try to bring us all together. We continue to have the important mitigation strategies, which stay home when you're sick, stay socially distanced, keep your hands washed, wear face covering when you're not able to. They're just such simple things that if they are followed, we can do exactly, again, what everybody wants and what the message we need to convey is we're doing these things to give us more freedom, to keep businesses open and schools open and support these children, to allow them to do some of the activities that they've had in the past. It may look a little different, but we're trying to do that. So I appreciate that. Are there other questions from the board for Dr. Landers? This has been a great discussion, I believe. Jerry, do you have any questions?
No, I don't, Mr. Chairman.
Okay, Dr. Landers, is there anything you'd like to add?
Just thank you. Thank you for doing what you're doing. You have a very difficult position. There are a lot of stakeholders, and I agree with Dr. Buitrago that bringing all those stakeholders to the table certainly has a benefit.
Well, thank you so much. This has been very enlightening and something that needs to sink into all of us. We have your presentation, all the slides. We will certainly be reviewing them. Again, we appreciate all of your time. I am still quite alarmed by the higher instance and the challenges you're seeing in the young people, and I get that now that they don't have control over anything. So we as adults need to come together to work together to give them some confidence that we have this under control to the best of our ability. We're doing everything that we can. And they're such simple things, you know, whether you support them, whether you believe they work or not. I know there's so much differing information. They're simple things. And for me, if they help a little bit, if it's what we can do to bring ourselves together as a community, I am going to do them all. And I'm sure we'll continue to call upon you, Dr. Landers. You've been such a good resource. So again, thank you.
Chairman, I just want to share that these slides were not available, but I will post them on our website with the meeting materials so they're available to the public.
Okay, thank you.
Assuming that's okay with Dr. Landers.
Sorry, yes, that'd be perfectly fine.
Thank you.
Thank you. I know he supplied them to us a few days ago, so we've had a chance to review, but they are some great information for the public. So thank you for doing that. We'll go ahead and move on to our next agenda item, which is some new mental health resources available. We have with us Shannon Fox, who is the 19 Crisis Community Resource Specialist with the Idaho Department of Health and Welfare. We appreciate you taking the time, Ms. Fox. We welcome you and look forward to hearing from you. So the time's yours.
Thank you so much for having me here. I'm very appreciative to be able to be a part of today's meeting. I normally watch these while you guys are doing them on, the weekly basis on YouTube. So it's lovely to be able to see everyone and interact. I'm going to go over the Idaho Strong program today. A little bit of background about myself before I jump into the Idaho Strong program is I do have a bachelor's in social work from Idaho State University. I've worked the last 5 years of my career in a nonprofit and have transitioned to still keeping that nonprofit position part-time, but I'm also now with the Idaho Department of Health and Welfare full-time. A lot of my background has been in abuse and trauma prevention, educating individuals on resilience, the impact of abuse and trauma on the brain, protective factors, all these things to kind of help our communities from a prevention standpoint. So when the Idaho Strong program came out and they were looking for individuals, it was kind of right up my alley because we know that, especially from Dr. Landers' presentation, that people are experiencing higher amounts of stress, and that stress has a trickle-down effect and it impacts our entire communities. And I saw this Idaho Strong position as a way for me to help, in regards to supporting people who have these experiences presently, and then also hopefully moving into kind of a prevention aspect to where we can maybe prevent some negative things from happening. So just to review the Idaho Strong program for all the members of the board, if you're not familiar with it, or the public that might be watching, the Idaho Strong program actually is a three-pronged kind of effort. So our first prong that I'm going to mention is our media campaign. So we have the Idaho Office of Emergency Management helping us with our media campaign. We have a Facebook, a Twitter, an Instagram, and we have billboards out in the community, some radio ads, and even some TV ads. And all of those resources are providing information on the Idaho Strong program and how it's acting as kind of an emotional support, stress reduction, resource guidance type of program. And so some of the media messaging will link people to the COVID Help Now line. Some of it might be about resources available in the community. Some of it will be linking people to the individuals who are in my position, which I'll talk about more in a moment. But that media campaign has been pretty helpful in just educating the community that, hey, there's something here for you when you're experiencing stress, or when you have a need, or when you just need to talk to somebody. Now, those individuals who might be experiencing that can call the COVID Help Now hotline. This hotline is set up to be anonymous. We don't really ask for any information unless that individual has notified the person on the call line that answered their call that they might need some more resources. But people can call for really any reason. It does not have to be necessarily COVID related. We don't want people to hesitate to call because maybe they don't have COVID or they don't feel like what they're experiencing is even related to COVID. We want anybody who's just maybe experiencing some challenges to call this hotline. And it's a 7-day-a-week hotline from 8 a.m. to 8 p.m. And they'll call, they'll get a warm person on the phone that's going to talk with them really about whatever they might be looking for. Some of that might just be to vent. Some of it is to maybe ask for resources. A lot of times we get questions for issues regarding financing, housing, and testing. So we do provide some information about, maybe people who need to get tested. But we also link people to resources in the community. And what this COVID Help Now line does is if a person is in higher need of maybe continued interaction, or they've expressed that they'd like somebody to follow up with them, the COVID Help Now line will refer that person to the individuals who are in my position. So my position is called the CCCRS. It's the COVID Crisis Community Resource Specialist. It's a mouthful. And that position is to help interact with these individuals who need maybe a little additional help from the call line. Now, I just want to mention, if people do call the hotline after the 8 p.m. hours, so between 8 p.m. and 8 a.m., they're going to be able to leave a message, and that'll be followed up on when the hotline opens again. But when people need that higher level of assistance, this program is actually generated normally for that, interacting with individuals to help them process the response to a disaster. This program is actually funded through FEMA and SAMHSA, and these grants are normally called CCP grants, which is Crisis Counseling Program grants. A lot of states receive these in response to disasters like hurricanes or tornadoes, floods, fires, or man-made disasters. And those, the people in my position under the CCP program are kind of normally doing what the hotline does, acting as a place where people can go, and these individuals actually would go out to the community door by door and just kind of ask how everyone's doing, assess their needs, assess their stress. Now that looks very, very different in COVID times. So that's why we have the hotline. But I get to help people who might need that little more assistance. And I have a couple of cases I can share with you this morning. One family that I was referred to assist was Spanish speaking only. They were facing eviction. They had 4 months back rent due. Their main source of income had been displaced because of COVID, and they were just struggling to kind of get their needs met to where they could get themselves lifted back up from their circumstances. We were able to assist that family. They did not get evicted from their home. Their children were able, the whole family was able to stay in the home. Now we're working with that family to get them some clothing, some furniture, formula, diapers, while they still work to catch up. Another case, which was one that didn't have the result we were hoping for, but we were still present in helping, was an individual who had been exposed to COVID, had to go through COVID testing. She was living daily in a motel because of her prior living circumstances not working out. She was a waitress, and so she was paying daily for her hotel. When she had to go and get tested for COVID, she could no longer work until she got her test results back. That meant her income that was funding her ability to have a roof over her head was gone. So she called us when she was getting pretty limited on the resources available. And we called and worked through every potential opportunity to try and get some help for her. Unfortunately, due to the complications of COVID and some other complications with her situation, she did end up going homeless over the weekend. And we did try to work with her to see, like I said, if any possibility would work. We tried even looking at things like BHC and the Behavioral Crisis Center. Those individuals we work with, we're not necessarily a case manager. We can offer resources and try to guide them through that process, but it's totally up to them on what they do and how they get through that situation. We're still working with that individual and still trying to make sure that we can give her a hand up to navigate the circumstances that she's in. The last case kind of just highlights that we're here just for people to talk to as well. We had a 19-year-old BYUI student call our hotline. She was very distressed because she had roommates who were COVID positive. She shared a room with one of those roommates, and she was having trouble navigating how to keep herself safe while keeping a roof over her head, while all of her family was in a different state. And so a lot of complication there. She really just needed somebody to talk to. We did end up sending her some stress reduction resources. So that's a huge part of my position, is trying to help these individuals who need that higher level of contact. On another level, though, I get to kind of interact with the communities that I serve. So I mentioned that there are 7 CCCRSs throughout the state, 1 per region. So I serve 10 counties that are part of Region 7. So that's going to include Bingham, Bonneville, Butte, Clark, Custer, Lemhi, Fremont, Jefferson, Madison, Teton. So I work with all those communities. And what I'm trying to do is assess where each community is at, so I can meet it where it's at. Where are the highest needs? What populations are facing the most challenges? Where's a lot of the stress? Who are the individuals who are going to be more at risk? My background with child abuse and trauma prevention, I understand the huge impact that trauma and negative early livelihood or early childhood life experiences can have on an individual. And I do believe that COVID has exacerbated some of what people are experiencing. So we have a lot of caregivers that might be going through a lot of stress, and those caregivers are normally stress buffers for their children. So we're trying to keep caregivers as being stable stress buffers for children. So how can we do that? How can we help navigate all of this? We also think about the populations that might be higher at risk, like those coming out of the correctional system, those with mental health challenges, those in poverty. All those populations it's really important to me that we reach out and try to help support those individuals. Now, another aspect of what we're trying to do is support all the people providing services, because we are all pretty, I would say, exhausted. If we're service providers or just people in general going through this, we're all pretty exhausted. So I'm trying to help make sure that when I work with an organization or a community, I'm asking how everyone is doing. How are the frontline workers? Do they have information about the resource that's currently on your screen, the coronavirus counseling assistance for frontline workers? I also have information for healthcare workers specifically about free counseling programs. So I'm trying to make sure that we kind of hit all the marks of who might be affected by this. That includes a lot of interacting with different community meetings already in place, and just trying to be a part of systems that are already occurring, which is why I'm so happy to be here this morning, because I want to add to the services, I want to add to the strength of the community and not try to recreate any wheels. So I think that is probably the best quick overview I can give of the program. I do want to see if there are any questions, any spots that I can maybe clarify what I said, because I know I went through a lot in a short amount of time. And then I can also comment at the end a little bit about how we're already collaborating with some programs.
Okay, thank you, Ms. Fox. Are there questions from board members?
This is Commissioner Young.
Go ahead.
Hi, Shannon. Thank you for being here. I see that you're doing a wonderful work, but how are you able to cope, and the workers that you work with, to address all these needs? I just see a Goliath of a problem, and such little resources. How's that going, the workload?
So this is a very large, multifaceted problem. Idaho getting this grant through FEMA and SAMHSA to put this program together, I think filled some of the gaps. I know we're not going to fill all of the gaps though, but what's important to me is understanding which gaps are there that may need the most kind of upfront interaction, so that way we can take care of the immediate needs. Across the state, that other individuals who are in positions like mine in the other regions, we all talk together. We work as a team across Idaho to make sure that we're being realistic. Normally, these programs serve kind of smaller geographical areas depending on a disaster. So if you think of floods, hurricanes, fires, things like that, they normally have a higher concentration of CCPs, which is my position, the crisis community crisis program counselors. And so it's different because of COVID, making it to where we're covering a large amount of area with less staff. But the fact that we even have this program, because Idaho has never had one of these before, is allowing us to do something. And we're going to continue tracking and seeing how we do and seeing where the needs are to make sure that we're not trying to stretch to cover everything in a way that would be ineffective. So I've been kind of going through brief interactions with a lot of different agencies that I think primarily could use higher levels of assistance. Like I met with Emerson Alternative School, which is part of School District 91 there in Bonneville. And we talked with that school district about the stress that their kids have, the families have, and the staff have, because that's an alternative school. So children that are going to that school normally have, more adverse experiences in their childhood. There's more complications there. So we talked about, how that school might need some more support just to keep things moving forward. It's definitely, there's a lot to do. There's a lot to cover. And I think I've been able to connect with a few of you through email and conversation about how I can support your community, because I do not know what each community needs, each county. So I'm really trying to look at each county, find the places where I can understand the needs. So that way I'm also not stretching myself to do things that aren't actually beneficial for the populations I'm working with.
Shannon, if it's all right with you, may I post your contact information along with these materials, that if there are organizations that would like to reach out to you, they can do that?
Oh, most definitely. And I would love to interact with anybody who has more questions or would like to see if there's a place where we can collaborate. I know that we had an individual talking earlier, about potentially putting task force together to talk about these issues. And it's always beneficial to bring people together for a discussion. And, if there were something like that to be developing or something that's already present, I know there's a lot of groups already present working on these issues. I would love to be a part of those as well.
Well, thank you very much. This is obviously very comprehensive, and I can see that it being a greater load than what the resource was allowed. So I really appreciated your response of focusing it more directly on those most at need and those places where you can have the greatest influence. So very much appreciate what you're doing. I know Director Jepson and the Department of Health and Welfare have been so proactive through this entire response, and we certainly appreciate what you are doing as part of that team. Any other questions? We'll go ahead and finish up then. Ms. Fox, with what, did you have anything that you wanted to add in conclusion?
Yeah, I think in regards to presenting right after Dr. Landers today, I think when we're looking at our community's overall mental health and structure for dealing with the immense amount of challenges right now, this kind of program can be a place where people can go to just vent and try to get through some things without maybe interacting directly with professional mental health services. I think that, when we look at what we can do, it can even just be sharing this information or looking at how your community might be able to benefit from some stress reduction. And that's, again, what this resource is designed for. We don't have enough capacity across mental health care systems to have everybody who's experiencing stress or anxiety or mental health challenges to, find services that fit their needs, or, for there to be enough services, especially in rural communities. So I just ask that if you would like to learn a little bit more, or if you have any ideas of how this can benefit, please contact me.
Okay, thank you very much. And thanks again for what you're doing in the communities. We'll go ahead and move on then to our next agenda item, which is a COVID-19 update from our director and epidemiologist.
Thank you, Mr. Chairman. And we will have just a very quick update today on the current situation. Every day we post the current day's numbers on our website, and those are showing on your screen now. I will just share that the last 2 weeks have continued to result in a lot of new daily cases. In fact, we hit a record of cases in one day, which was 209 very recently. And certainly we're concerned about the increase in numbers. I wanted to share that Lemhi County, you can see their rate here is 57.3. They have exceeded the metric of being over 45 active cases per 10,000 population for 3 consecutive days now. And so today they will move into the orange risk level, awareness level. Also, Fremont County and Bonneville County have reach that 30 per 10,000 rate just for one day. And so we're watching that, and they could easily move into the orange level in the next couple of days. I would just share that I'm going to just go to our dashboard very quickly. And if there's specific items you'd like me to cover, please say, but I just wanted to show a couple of things. I mentioned before that we are actually working to redevelop our Tableau or our data dashboard. We hope to have that here very soon in the coming week or so. But one thing that has been added, and I'm sorry it's not displaying very well right here at all, but we've started displaying not only the number of hospitalizations for the residents within our health district, and that is depicted right here by this black line that shows here at the end. We have 45 residents of our health district hospitalized as of yesterday. But right here, we're starting to report, thanks to the information provided to us by the hospitals, of the total number of COVID patients hospitalized in our region. And you heard that earlier from Mr. Hoffenberg of all the people outside of our health district that are being served. So right now in our regional hospitals, we have 59 individuals hospitalized with COVID. Are there any specific details on any of the data that you would like me to cover this morning?
Any questions? Board members, we've become very familiar with it and where to find the information, and I trust and hope that the community is as well, because you've put together just a great amount of information that is easily accessible. It was very concerning to see, those hospital numbers rise this past week. And so I was glad to hear that they're handling the surge right now, but it is certainly concerning as we all have become to understand that they follow rising case numbers. So it makes it very important. Is there anything else, Director or James, that you'd like to add?
I will just add one more thing quickly is that we have started to receive an allocation of the Binax Now test that the state has received from the federal government. The state's testing task force has prioritized the use of those tests. And the first priority is schools. So for teachers, staff, and students, we're working with local providers within each of the 8 counties to be able to offer those tests to that population. We hope to have the majority of those arrangements in place here very soon. We've been working hard to get providers in all of our areas to be able to offer those to that population. We'll continue to get allocation of those tests and distribute them in accordance with the testing task force priorities for each of the weekly shipments. So I just wanted to let you all know that.
Okay, thank you. Seeing no other questions, we'll go ahead and move to the next item on our agenda, discussion and possible revision of the plan. I know you've been working so hard on that. Where are we at now?
Yeah, Mr. Chairman, thank you. And I just want to say I'm not prepared to present any revisions this morning. After we made revisions at our last meeting, we have continued to try to figure out the balance for that plan, the best information to be able to include in that plan. And as we evaluate all the data, are struggling with the best changes to make it the best plan possible. And so I was feeling after our last meeting a need to still make some additional tweaks to it. But unfortunately, I'm not prepared to present that today. So I would propose that we put that on our agenda for our next meeting. May I also share that I know there's members of the public that are anxious to have the revised plan, and I'm hesitant we don't actually have the finalized document as I was working toward proposing some additional changes. But I am happy to just list those specific changes on our website that we made at the last meeting. We did share a press release after that meeting with all of those changes included in that, so that is available to the public as well. But I'm happy to put some additional information on the website with those specific changes until we do get a finalized plan and are able to publish that for the public.
All right, thank you. I know you've been just working incredibly hard on this, and time is so limited. And so we just appreciate what you're doing. We ask the patience of the public as we try to work through this. We want to make sure we get it as right as possible. We knew from the beginning that it was going to be a plan that would develop as we learn more and as new information came in. And so that's what we've been doing, to try to be as responsive as possible, to not try to not get locked into old data and old ideas, but to try to evolve the best that we can to help with as much as we can, to do as much as possible. And I know you've been working hard on that, Director Rakow, and we'll continue to support you on that. We'll look forward to seeing those recommendations then at our next meeting. I guess I wanted to add something here at the end, but first I'll ask if there's questions from board members or thoughts that you'd like to share.
Commissioner Reed, this is Commissioner Mendenhall.
Go ahead.
I would hope anyone that, yes, the board members, but anyone in the public that is viewing or watching this YouTube, a lot of the emails we get do have a single viewpoint, and a lot of the emails are, my single viewpoint is the best. Why are you not paying attention to my viewpoint. Why are you not doing this? And as a board, we have tried to look at all viewpoints and take all in. I would hope anybody that is watching this today, whether you support the board or whether you don't, that's a choice that you have the opportunity to make in the land we live. But I'd hope you'd really pay attention to Dr. Landers. That I was really impressed as he made those statements that, you know, the only way we're gonna really get ahead of this is jointly and cooperatively, and there is no one single way that is going to accomplish that, but it is together that it will. And I'm not on a soapbox saying that. I'm just hoping that the public will take a look at Dr. Landers. I wish we could shout that from the mountaintops of the things that he was talking about with mental health and with issues and concerns, but it's going to take a full cooperative effort or it's not going to work. And so I appreciate Dr. Landers and the comments that he made. So thank you.
Thank you. Is there anyone else?
Yes, this is Commissioner Young, Mr. Chairman. I'd kind of like to add to what Commissioner Mendenhall said. It's, as I listened, a fantastic presentation by Dr. Landers. And many of the things that he presented, I saw myself personally struggling with that I hadn't realized before. And I think people are sometimes in these situations. But as Shannon spoke and as Dr. Landers spoke, it's like I kind of saw the Teton flood again. And I saw how the community come together and succeeded. They had a plan and they worked together, and they did have leaders that coordinated with the workers and actually brought the community together. I hope that maybe as a health board we can look at these things and how can we better involve the community leaders so that the burden's not completely on us, and how we can involve and work together. I understand the opposing views from hey, let's pretend COVID's not here. But the catch-22 on that, living a lifestyle like that, we know as health board members and from the testimony of all our doctors, the consequences of that on our healthcare workers. So it's kind of a catch-22. And somehow the key in this that I see and that I learned from Dr. Landers today and also from Shannon is that somehow we need to work together and involve everyone, our emergency managers, our mayors, and just others who can come forward to help out on this and working with schools but anyway, maybe our plan could address those kind of things too, is how can we make a line of command and to get people more involved and come together. It seems like the mask mandate is the most contentious thing we have, and it's hard to overcome that, and I'm not sure how we could do it, but maybe working together we can. So that's all I've got this morning. Thank you.
Thank you. I wanted to just read one thing that came out from Governor Little's desk yesterday. And again, this is from the governor, and I'll just read it directly. He said, as COVID-19 cases increase in communities across Idaho, I urge Idahoans to ramp up personal actions to slow the spread of the virus, to protect lives and our economic prosperity. Our personal actions work better to slow the spread of coronavirus than anything else. Our personal actions are free of cost and are a minor sacrifice relative to the rewards. This is about personal responsibility, something Idaho is all about. Wear a mask, watch your distance from others, wash your hands, do the things that our kids, so that our kids can stay in school and our economy can continue to prosper. And he continues. I really like that, and that's the direction that our board is going. And it sounds like it fits into Dr. Landers' thoughts, and that is to encourage more personal responsibility. We're doing all we can do, I believe, as a board, and I certainly Eastern Idaho Public Health, our staff, our director, our epidemiologist, everyone there is doing all they can do. And so it's time now for community leaders, for the public, for everyone. And I appreciated what Commissioner Mendenhall said. If you disagree, then let's do as Dr. Landers said. Let's come together. Please don't work against us. That has been so harmful to hear state leaders, local community leaders, others in the community work against us. We're trying to find the best solution. We know that everybody doesn't agree, and no, we won't all agree all the time. But if anything can help in a small way, I'm willing to do it. Whether the Google reports are mixed on it or not, if that's what's being recommended by our healthcare professionals and Eastern Iowa Public Health, then I'm willing to do it, even if it helps a fraction. And we all need to do that, I believe. That's my personal belief. We learned today, and it's very concerning in my heart, the mental health challenges that are out there, particularly for these young people. And but let us not forget that there's also people that are very sick. It affects everybody in a different way. And just because they have a comorbidity or they're my age and older, their life is no less. And so when they're getting sick and seems like having deaths reported on a frequent basis, that's serious. And so we've got to look at the holistic approach to this. We've got to consider all sides. And I believe we're trying to do that. I appreciate everyone's efforts so much. And I appreciate those that are working and helping us. And again, please bring us your thoughts if you have concerns with what we're doing, because we want to hear them. We want to do what's best for the community. And we'll continue to do that regardless of what happens. We didn't ask for this responsibility, but we will continue to fill it out. And having all 9 board members here today and nearly each and every week shows our commitment to do what we need to do. So with that, unless Director Rakow has something to add, we are a little unsure of our next meeting date. Please let us discuss this a little bit for a day or two. It may be in 2 weeks. If we find it necessary, we'll meet next week. But please give us a day or two, board members, and then we'll get that information out to you. And of course, we'll try to get it published on our agenda just as soon as we can. We're required to have a minimum of 24 hours in advance, and because everything's been so fast moving, that's about the best that we've been able to do. But we will get it published as soon as possible so the public knows when we'll be meeting next. So with that, I'll go ahead and bring this meeting to a close. Thank you, everyone.
Thank you.
Thanks.
Thank you.